We're good to go.
Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 112,672 confirmed cases of COVID-19 in Canada and 38,210 cases in Ontario. Chatham-Kent has 214 cases and Sarnia-Lambton has reported 292 cases. Michigan now has 75,947 cases, with 12,335 cases being in Detroit. Today, we are reporting 2,124 cases of COVID-19 in our community, an increase of 53 cases from yesterday. 43 are workers in the agrifarm sector, 5 cases are in the community, and 5 cases are being investigated at this time. 1,365 people have now resolved, and 658 people are self-isolating. 15 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39. 65% are male, and 34% are female, with 1% unknown. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes in COVID outbreak. In addition, there are 10 workplace outbreaks. 8 are in the agriculture sector and 2 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Please be reminded that Windsor Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for the weekly EPI summary.
Good morning, and thank you everyone for joining us for our epidemiological summary. Okay, so here's what we will cover in our presentation today. Since there's a lot to go over, I will highlight the key points in each of the slides. The EPI summary or Epicurve help us assess the progression of the disease, whether in the community or in an outbreak situation. We created this particular Epicurve to show the confirmed cases by the date it was reported to public health. On your vertical axis, you have number of confirmed cases, and on the horizontal axis, you have the date these cases are reported to the public. This figure includes all cases, that is cases in the community, including cases in the long-term care home, retirement home, as well as the agricultural industry. Day-to-day variation can vary significantly, and we know COVID-19 do not cause disease after exposure immediately. And in order to minimize the impact of day-to-day variation, another way to look at the Epicurve is to look at the 3-day moving average by reporting date. The 3-day moving average help to capture day-to-day variation, and we'll try to present a better picture of how things are going in our community. We can see that roughly since second and third week of April, the number of cases was going down and moving in the right direction. In early May, We notice a further decline, but then we are seeing most of these cases picking up again in our region, mostly tied to the agri-farm sector, but we are also seeing some cases outside of the agri-farm sector as well. Most of them are close contact, or some of them are acquired through the community spread. Also note that there were some restrictions were eased in stage 2, and we are seeing an increase in the cases outside of the agri-farm sector, mainly because after those restrictions were removed. This figure further breaks down the cases by agri-farm sector versus non-agri-farm cases. The majority of the cases we're now seeing are coming from the agri-farm sector. However, we are also seeing cases acquired outside of the sector, which is a concern in the community. We need to ensure that we are practicing physical distancing and limiting our social circle as much as possible. This particular graph looks at the cases that present to our emergency department at Windsor Regional Hospital and the Erie Shores Healthcare Hospital with symptoms that is suggestive of COVID-19, such as cough, fever, pneumonia, and many others. The green line is the current 2019-2020 season, which started in September 2019 and goes until the end of August 2020. We are currently in week 30th. The blue line is the 2018-19 season as a comparator. As we have seen in the previous presentation, we saw a high number of cases and high number of syndromic visits in the emergency department in March to May. It started to decrease, but now we are seeing that it's starting to pick up again. Focusing only on in the Leamington area at the Erie Shores Healthcare, we don't see the same trend, but what we are seeing in the last 2 weeks, which is week 29 and week 30, there is a significant uptake in the 2019-2020 ER department visit as a result of COVID-related syndrome, which is represented in the green line in this graph. This figure looks at the number of unique individuals tested per day and whether their lab test results return positive. Individuals tested multiple times on different days are counted only once in each week's count they were tested for. In the middle of March to mid-April, the number of individuals returning as positive was between 13 to 22%. Currently, as of July 18th, 4% of these individuals are now testing positive. Please note that for the most recent week, the information might not be complete due to reporting lags with the lab. One of the common methods of looking at how we are doing is also using a 7-day moving average to look at our overall trend in the case in the number of confirmed cases in the region. The blue line looks at all of our cases using a 7-day moving average, including all the community cases, the retirement home, long-term care home, including agri-farm sector. We see a peak in late March. Overall, in March and April, the latter is attributed to the outbreak in long-term care home and retirement home. Right now, what we are seeing is the agri-farm sector is driving our 7-day moving average. The green line looks at the 7-day moving average if we were to remove the workers in the agri-farm sector, and we'll still notice that the 7-day moving average declines dramatically from May onwards when we exclude the agri-farm sector. However, in the last 2 weeks or so, we have been seeing an increase in the 7-day moving average of cases that are outside of the agri-farm sector. We were stabilized to about 5 cases a day in May and June from the community, but now we're seeing up to 13 cases per day from the community. This slide captures the week-over-week incidence rate per 100,000 population from week 18th that started in April 27th to our current week, which is week 30th. We saw a dramatic increase in cases in week 26, which are primarily attributed to the agri-farm sector, but we are now seeing cases outside of the sector as well. Please note that week 30th is still in progress and it ends on Sunday. Comparing ourselves with the rest of the province and other regions, Windsor Essex now has the highest rate in the province, and our rates are higher than anyone else in any other public health unit in the province. For us here locally, we have experienced a higher proportion of cases in the long-term care home and retirement home that is currently standing at 17%, but at its peak, it was 42%. And all these cases in the long-term care home and retirement home included staff as well as residents. We are currently now seeing an increase in the number of individuals in the agrifarm sector who are ill, which is constituting approximately 46% of the cases, or roughly half of our cases were attributed to the agrifarm sector. We know that Windsor Essex is a home to a large number of farms and have the highest number of agrifarm sector in the entire province that are participating through the temporary foreign workers program. Looking at the rates of these cases by each of the municipality, what we are noticing is the rates per 100,000 by municipality show Kingsville and Leamington have the highest rate in Windsor and Essex, followed by the city of Windsor. We were talking about age breakdown of individuals in our region, and so this particular graph is showing at the age breakdown by percentage for each of the municipality. The green and orange or yellow bars shows that there are a high number of young cases across each of the municipality. This is higher in Leamington and Kingsville, primarily due to the agri-farm worker who are at the working age between 20 and 40 years of age. Tecumseh reported higher proportion of older individuals, 80 plus, whereas Amherstburg reported a higher number of young people between 0 to 19 years of age in the dark blue colors. Many of these individuals in the higher age group also includes individuals from the long-term care home and retirement home, depending on their geographic location within the municipalities. Here we are looking at the overall cases, not by municipality, but overall Windsor Essex and what it looks like in the past 2 weeks. Overall, we have seen more male cases compared to females, and this number is disproportionately high in males within the past 2 weeks. When it comes to age, we are seeing a high number of cases among the 20 to 40 years of age in the past 2 weeks, and the low number of cases in the older age group. However, overall, about 8% of our cases were 80 years or older. Looking at our overall distribution of COVID-19 cases by municipality, what we can see is the overall 37% of our cases have been from Leamington, 33% from Windsor, and 21% from Kingsville. This is since the beginning of this pandemic. Breaking it down further, in the past 30 days, 47% of our cases were coming from Leamington and 27% from Kingsville, and while Windsor accounted for 22% of the caseloads in the region. Drilling it down further, in the last 7 days, it tells us a different story, and 37% of our cases are from Leamington and 26% from Kingsville. And 31% from Windsor, which is again, Windsor case counts were going down, but now it's starting to pick up again, partially because of the, probably because of the stage 2 reopening and people not following all these public health measures. Here we are looking at how our cases acquired COVID. We see that early on it was imported to Windsor Essex via travel, and many of these travel-related cases were contained. From then, we saw in March some community spread, but predominantly spread through close contact. Close contact spread includes outbreak in institutions like long-term care home and retirement home as well. Close contact also includes predominantly agri-farm cases in our region as well. This slide looks at the exposure of agri-farm foreign workers since the middle of May. While the majority of the cases have primarily acquired the illness through close contact, we are seeing instances where it is also community acquired. This figure looks at the non-agri-farm cases since June. While most of the cases are close contact, we are seeing cases acquired through community transmission, where cases are unable to identify a close contact nor it being travel related. Another question that's frequently asked about the healthcare worker given our unique border situation. So this graph breaks down the healthcare worker by their location of work, whether they were from Michigan or whether they are from local or international. We can see 81% of our healthcare workers are from the region or acquired through international travel, while as less than 20% of the cases are from the healthcare workers who work in Michigan. A quick look at the cases and what symptoms they are reporting. By far, cough and fever continues to be the most dominating symptom of case presentation. Please note that these cases can report more than one symptom, and that is why these numbers will not add up. Another metrics to look at: the hospitalization and ICU rates in the region. It includes both new patients and existing patients with COVID-19. What we have seen is the cases in the ICU have increased to levels seen in May. Then the red line indicates a 7-day moving average in the ICU, showing an increase in the last 7 days, where the cases are, some of these cases are ending up in ICU. Hospitalizations have fluctuated more so than the ICU. While we see a sharp decline in June, we're now seeing an increase again in the hospital cases of COVID-19. Looking at our overall health system capacity, what we are noticing is the orange line indicating the occupancy rate of all our acute care beds, not just for COVID, but entire hospital. The threshold is to have the occupancy rate below 85%, which are currently meeting, but not by that much. So we're just barely touching that 85% mark. This signals that we are currently able to meet the demands related to COVID, but we are being stretched at this time with the hospital capacity. The green and blue, dark blue lines are for ICU capacity and ICU ventilator beds respectively. For ICU capacity, we'll look at the overall ICU capacity and ICU ventilator beds. While there is no established threshold overall, we are aiming to be less than 50% for overall ICU beds occupied. Higher than this may lead to stress to the healthcare system. So looking at how our cases are doing, more than or close to 2/3 of our cases are resolved, while roughly less than one-third of cases are currently self-isolating. Unfortunately, we lost 3% of our population to the COVID-19. We are still investigating, the hospitalization and ICU beds continue to stay low in terms of overall hospitalization in the region. And we're still investigating less than 1% of our cases as reported to us. Looking at the lives that are lost in our region and the age and sex breakdown of COVID-19 related deaths in our community. Overall, more female died with COVID diagnosis compared to males. From an age distribution perspective, almost 70% of the deaths were in individuals who were 80 years and older. The youngest person who died in our region was a man in his 20s. This particular graph shows that what it means for an individual who contracts COVID-19 in our region. In our community, the overall case fatality rate continues to be lower than the provincial average at 3.3%. Those who are living in the long-term care home and retirement home, the case fatality rate is again below the provincial average, which stands at 21%, and our rates are close to 15.9%. The general direction we are moving in as a country is good. We are also seeing positive signs in the province of Ontario. In Windsor Essex, our day-to-day doubling time has dropped due to the high number of cases we have seen in the past couple of weeks. This fluctuates day over day due to spikes in our cases. The most recent estimated mean R naught is 0.83. This has increased from last week, but still below 1. When the R naught is less than 1, every infection caused less than 1 new infection, signaling a decrease in the virus activity in our community. When the R naught is greater than 1, each existing infection can cause more than 1 new infection. Our R naught estimate varied greatly due to the influx of cases from the agrifarm sector in different timelines. The shaded area demonstrates the variation we see. So in summary, Windsor Essex is seeing more cases outside of the agrifarm sector in the most recent last couple of weeks. The primary source of exposure continued to be the close contact with the confirmed case. COVID-19 related hospitalization and ICU overall was relatively better in our region, but in the last 7 days we have seen an increase in the hospitalization and ICU beds occupancy in the region. The overall R naught effective rate is 0.83. It is a slight increase compared to the last week, but overall it continues to stay less than 1. But we have seen some significant variation in the past month and a half. Thank you.
The conference is now unmuted.
We'll now take
Questions from the media. Any questions from Blackburn?
Yeah, I guess just looking at and this might be more of a question for the hospital, but I'll ask it anyways. If we hit this capacity level at the hospital, is that a signal that the community needs to move back into stage 1?
Again, some of these decisions are provincial decisions, and the provincial body is looking at all those indicators. Some of the indicator criteria that they look at is definitely the community spread, the activity, virus containment activity, and also from the health system response capacity. We know that we have the field hospital that still it can be used if the surge is there. But as we are seeing some cases in the hospital and ICU, some of them are improving as well, so they will be moved out. So right now we are at 50% capacity at the ICU, and overall the hospital beds capacity at 85%. Obviously, if things change, the move for elective surgery that was started in the hospital, my guess is that will be something that maybe have to look again. But all of those decisions have to happen at the provincial level, and then some local discussion as well with the hospitals to see how they're doing with the capacity.
Thank you.
Any questions from AM 800?
I guess a follow-up to Maureen's point, Dr. Ahmed, if the Premier or someone from the Ministry of Health contacted you today and wanted your recommendation about stage 1, and if they did go backwards, would you tell them, or do you feel Windsor Essex should go backwards to stage 1?
I don't think that we will be in a position to go back at this time, given that the activity is still limited to a specific sector, and most of these activity is happening as a result of a close contact exposure. So I think I don't think that there's any reason to go back, but I think we definitely need to make sure that we continue to follow all those public health measures the way we are right now, to find that right balance of public health measures as well as economic and societal disruption and causing more harm.
Just a question about the agri-food sector. I'm just looking for clarification. I just don't understand how the numbers keep on climbing in that sector. For example, if someone that works in that sector has COVID, they're isolated, or confirmed case of COVID, they're isolated for 14 days. How are all these new cases popping up if the ones that had it are in isolation?
Good question, Rob. So what happens is the challenging part is if people are not physically distancing while at work. So that's why the key recommendations that we have always been trying to hammer down every day is about the physical distancing. It's about the use of the mask. It's about ensuring that you are not having more than 10 people close contact, or even less than that. The challenge with these farm workers is that they're congregate living settings. Many times that these individuals are living in 15, 20 people together. And if you have one case, and if that person, just because of the nature of the work, sometimes they may not even realize that it's a symptom. They take Tylenols for body aches, malaise, headaches, and do not realize that it could be a COVID symptom. And by the time they are coming in contact with not only the people that they live with in the same bunkhouse, but maybe with people who are outside of their bunkhouse. So now you have 2 cases in 2 different bunkhouses, but as a fallback, what happens is all the people who are living in each of these bunkhouses, now 15 to 20 people are exposed. So potentially from those 2 people, you can have 30 or 35 cases just because those people are not physically distancing, and their congregate living setting, their communal areas, their shared kitchen, their shared bathrooms, everything, it just puts them at a higher risk. So it's even one case that we are seeing in the community, maybe that ends up in resulting, maybe infecting 1 additional family member or 2 additional family member. By that comparison, they are infecting 15, 20 other people. So that's why we are seeing a huge surge every time, even there are initially few cases to begin with. And then when we identify those cases, what we do is we put all these individuals immediately in an isolation rooms so that they are not able to spread it to others, even if they are developing the disease. So by doing that, what we are doing is we are still protecting many of the individuals who may not develop the disease otherwise, just being in the same proximity. So all of those measures are there, but that's why it was a concern. And I think going back to some of the initial messaging is still key, that prevention is the key for everyone, including these workers, because once it starts spreading in these congregate living setting, it is very difficult. They will have a number of cases that needs to be monitored, that needs to be managed, putting a significant strain in their operation, as well as the overall case count and the health and well-being of their workers.
Thank you.
Any questions from Windsor Star?
Yes, Doctor. You're talking about preventing the spread through these congregate living settings. Could you talk about how, if public health wasn't doing the work that it's doing to trace the contacts and self-isolate the individuals, what would it look like in the farming population now in terms of spread?
It could have been worse because first of all, when we are talking about these workers on its own, anyone who gets sick, we know COVID. It's not just as most of the time, most people will recover fine, but up to 20% of the people can end up in hospital, and you can still have close to even our fatality rate 3%, or even maybe as an overall younger population, you can still have people who can potentially die from it. So if those individuals, if those cases are not picked up at the right time by public health or by healthcare system, they can have worse consequences. So that's one thing. Second thing is, if we are not doing our case and contact management, then it can basically just infect everyone at the workplace. So all of these workplaces that we are even seeing right now outside of the agrifarm sector, if they have cases that can still be contained because they go back and they isolate themselves in their own homes, because if they're residents in our region, they have the ability to do that. Unfortunately, these individuals, they do not have the ability to self-isolate with the 15, 20 people. And then it can potentially go on and on and on. And what we have seen with one of the bigger farm that we had to remove their workers from work, it's pretty much like 50% of their 50% of their worker got infected. So that's the situation that people can end up with if they are not picked up at the right time. And through all these prevention effort and then proactive testing immediately when someone is showing any symptom, removing them immediately from the workforce. That's the best thing that anyone can do, and ensuring that they have good systems in place for screening people so that they are not missing any of these workers. And when workers are in that farm, they need to make sure that they are maintaining physical distancing appropriately and wearing the mask if physical distancing cannot be maintained. So even if when we're looking right from the beginning, we're talking about a population that is highly vulnerable, a population that can easily spread these cases to the rest of the worker population, and the worker themselves. I think it is a significant problem, and it could have been maybe worse by if the right actions are not taken at the right time.
Thank you, Doctor.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. I heard you talk about it a little bit on the radio this morning on M800, but yesterday we discussed the possible outbreak in a retail outlet on the East End. Now, you said that if there are two or more workers connected to an establishment, then you'll be putting the information out there, but that established link hadn't been made. So having said that, we confirmed that 4 workers from Walmart contracted the virus. So I'm curious, are they considered community cases, which is why that established link wasn't made to the workforce, or sorry, to the workplace?
So good question, Bob. And I think what we were trying to, I guess, as I said, we always try to establish if there's any link at the workplace. But all these 4 people, they are household contacts of each other. And they are primarily students, and now they're working at these retail store. So their primary contact was from their household, and I think two of them were isolating at the time when they contracted the disease. And even though they were workers, but there is a little bit of detail that we are still trying to figure out whether if any of them worked while they were infectious at the Walmart, because the ones that we are talking about, they were self-isolating before. So that's the part that I'm still getting the information from my team, and we'll act on it. But based on what we know so far, is they're all household contacts. They were all living together, and the acquisition happened at the home, and we do not have information, at least at this time, whether if any of them worked while they were symptomatic or while they were infectious from a public health perspective.
All right, so I guess the question needs to be asked then, should residents who shop there or any other place that may have been infected or affected be concerned?
Well, I think my message has always been, if you're going to any of these commercial establishments, by default, you should assume that anyone that you are interacting with, anyone you're coming in contact with, could potentially have COVID. So you always do everything that you need to do. So at the time when you're entering a commercial establishment, you clean your hands so that when you're touching any of the product or coming in contact with anyone, you are not contaminating your germs, whether you are aware or whether you're not, to any of the other surfaces that can potentially act as a secondary transmitter, even though we know that the evidence for these type of transmission is limited, but there is this possibility. And then immediately when you are inside the facility, if you continue to don't shop around, don't touch everything that you don't need to buy, and then when you're coming out of the establishment, you clean your hands immediately and by alcohol-based hand sanitizer, or wash your hands. So taking all those measures would basically eliminate any risks that you could potentially have in any of these commercial establishments. So that would be my recommendation. And irrespective whether you know if a facility had someone who had COVID or not, those measures, those recommendations should be followed all the time, irrespective of that. And now going down to the specific question that you asked for people who shop there, should they be concerned? I would say at this point, we do not have that information. I don't think that there is any need to concern at this point, unless they come in direct contact with any of those workers who while they were working. And all these mask policies, all this physical distancing policies is there just for that purpose.
Okay, and I don't want to take up all the time here, but real quick, when is a workplace outbreak considered a workplace outbreak?
So if you have one person who are not a household contact, but let's say if you went to a commercial establishment, I went to the same commercial establishment, we're not connected otherwise, and then with the timeline, the establishment, that there is no other risk, but primarily if one of us got the disease from someone, or even transmitted it to you, or from you to me, that will be the indication that you have established an epi link based on the timeline that both of us were in the same commercial establishment, based on the location that it was the same commercial establishment, and based on the fact that the two of us were there. So time, place, and person, all those things are there, and resulted in a possible transmission. So that means that if these two people are identified, then there may be other people who could have come in contact with that person. And then again, going back to some of the same messaging, is ensuring that from a true community risk perspective, I should take all these precautions when I'm out there to ensure that, I'm not putting anyone at risk.
Okay. Thank you for the clarification, Doctor. Appreciate it. I have one more, but I'll save it for the next round.
Okay. Any questions from CBC?
Yeah, hi, Dr. Ahmed. I just wanted to ask what your reaction is to the region having the highest rate of COVID-19 in the province.
It is definitely stressful, concerning, and we've been dealing with this for quite some time now. And as much as we like to see that number going down, but unfortunately, some of the risks that we have in our region are very unique to us, and the challenges that it brings, it's very unique to us. All I can say is it's for some, it may be just the number as well, but it also means the time, the energy, the efforts that our staff are putting in is also multiplied significantly just because based on that part. And my message to the community has always been to take some, we're in this together. We all have to do our part, and unless we all work together, unless we all do our part, it has the potential to get worse, even worse than what we are seeing right now. So I think we all need to work together to make sure that we are keeping our community safe.
And this high rate, could that really be just a result of the rigorous testing that the region is doing?
Well, I think it's a combination of both, because yes, when you test more, you will find more cases, which is great, but also it gives you an opportunity to contain those cases. So definitely those testing is important, but also from a long-term prevention perspective, that's where I think we need to make sure that we are doing other things in addition to testing as well, to make sure that we are not getting the cases in the first place and not just picking it up by testing people all the time. We need to do more on the prevention side, more upstream work to prevent anyone from acquiring the disease. And then as soon as if someone is acquiring the disease, they should be self-isolating immediately, staying home when they're sick. Those are the measures that they can do to prevent it spreading from in the community. But I do want that these testing that's happening, it should continue in a manner that provides us with more answers and better tools to contain it.
Thanks so much.
Any questions from Queen's Park Briefing?
Yes, thank you. Hi, Doctor. I understand that Switch Health is no longer doing mobile testing in the public health unit. Can you explain if on-site testing is still needed and if it's still happening?
So many of these what is happening through our case and contact investigation, outbreak investigation, our team, the hospital team, we team up together to go, and including EMS, we go together and we do the on-site testing. We have done that in the past. Our team, when we had the capacity, we were going out to do the testing as part of that investigation as well. Right now, what we are knowing is what we're finding out is this resources are getting stretched, and we are all trying to do the right thing. On-site testing is something that Ontario Health is still trying to provide, and we are aware that some of these testing will continue with a combination of on-site testing as well as the site that was initially set up. So a combination of all of that will help to continue on with the testing as needed in the community.
Thanks. To follow up, Dr. Williams spoke about a communication problem that led to sort of a pause in testing that has since restarted. Can you explain what that communication problem was and what status things are at with that?
So I think as we are talking about this agri-farm sector, there are definitely many different players and many different responsibilities when we are talking about each of the stakeholders involved. So from a public health perspective, obviously our role is in the case and contact management and also in prevention and education of all these workplaces. So that work was ongoing right from the beginning. And then you have roles from the Ministry of Labor as well for the actual workplace and their responsibility. You have role from OMAFRA as well that's the ministry that oversees all the agriculture farming industry as a whole. And then having a good flow of information from all the agencies, all the messaging in terms of containment of the disease, in terms of the investigation. So a lot of that information need to flow seamlessly, and sometimes the challenge is if, like, as much as a good job we try to do in explaining what public health, how public health rationalize and how public health manage each of these outbreak situation. But just like any other clinical specialty, every case is different case, and you have to manage them accordingly based on the information, based on the investigation we carry out in each of these cases. One formula cannot fit everyone else. So sometimes the challenge is the information, if it's coming from public health, if it's taken up by another agencies or another individual to convey that information, it may not be necessarily be understood or conveyed in a clear manner. That's where some of these confusion can happen. And what we are trying to do is, now there are good established working groups, even with the ministry, with the MAFRA, and the overall stakeholders, the healthcare system partners. So there are more communication now that's happening, where all of us are trying to make sure that we all have the same messaging, and we are working together to provide a consistent guidelines, consistent messaging to the industry, to everyone who's involved, so everyone knows whose responsibility, whose role is what, and it should help to avoid any of these confusion.
Great, thanks. Just to follow up on the first question there, was the Switch Health mobile testing helpful, and do you wish that it was still happening?
Well, I guess I cannot comment on the specific of any one particular company versus the other, but I do think that there are some pros and cons of having mobile testing versus sending these people at the assessment center. Obviously, from a resource perspective, it makes sense that that you shouldn't be going into each of these farms individually, because it takes a lot of energy and a lot of resources to make it available on site. But you also don't want anyone who is symptomatic or positive to showing up in large number and potentially exposing other people, and the way they come to the assessment center. So there are pros and cons in both the approach, but having the ability to do both, I think that's what would be best for the community and best for the industry. So I think having those access is something that we are looking forward to.
Thank you.
Any further questions from Blackburn?
No, thank you.
AM 800?
Dr. Ahmed or Teresa, I'm not sure who this one's for, but when it comes, you mentioned the testing, the mobile testing. I know last month, I believe it was, you and the team and EMS went out to different municipalities for community testing. With the community numbers going up, I know they were down today compared to earlier in the week, but with the community numbers going up, has the health unit and EMS considered doing those mobile testing in parking lots at the arenas again?
Good question, Rob. And surprisingly enough, we were just talking about it the other day, me and Teresa. But recognizing that with the high number of cases that we're seeing in the region, and also the resources from EMS is pretty thin. We did contemplated that, but right now I think the focus is on the case and contact management and containment of what's happening in the agri-farm sector. So all the resources are going there to make sure that, because that's what we know. And if you look at some of our epi summary, most of these activity is happening in those in that region. So we want to make sure that first we address that, and then if we get some resources available to us, maybe we'll consider that. But right now, from a resource perspective, it's not something that we can do.
Okay, thank you. Have a great weekend.
Windsor Star?
I'm good. Thank you very much.
CTV?
Yeah, actually, now I got a couple all of a sudden. So we just received a news tip from a viewer saying that there may have been an outbreak in a child care center. Do you know anything about that, Dr. Ahmed?
We have one child care facility that we are that is under outbreak that we are following, and all of the contacts, all the people who are part of that, who attended that child care facility, have been notified, and they are self-isolating at this time.
Okay. Also, just reading off a text here. So, have you heard anything about a greenhouse being or forcing its workers to get tested?
That I'm not aware of.
No. Okay. We just got word that that might have happened or is happening at one of the farms out in, I think it's Kingsville. So, nothing.
Well, I think what I have been always saying that any farm that is currently under outbreak, we do strongly recommend that their workers should get tested, especially if it's widespread cases of COVID-19. It is in the best interest to know the extent of the spread and take appropriate measure before it spreads further.
Can you or will you at some point force the farms to have their workers tested? Because I know that's still a big issue in the community, right? So just thought I'd throw that out there.
Short answer is yes, especially if we have established that high risk, which we have done in few times, that there is a high risk. But so far, all I can say is I didn't have to force them. It's just based on the conversation and understanding the issue. The farm owners, operators have come through and followed our recommendation. So I didn't have to force anyone at this time. But in the worst case scenario, if we are in that situation, because of the risk, that option will be available for me to use.
All right. Thanks for that. Have a good weekend, sir.
Thank you.
CBC?
Yeah, just another question. Dr. Ahmed, does an agrifarm worker or a healthcare worker need to show proof of that negative test and have that negative test to be cleared to go back to work?
From a clearance perspective, so two questions I see. A proof of test is something I think it can be through a policy. An organization can set up a policy to say that as part of the requirement, you need to have this. For example, as if I can recall, most of the workplaces that I work. And in public health, we do ask for immunization requirement, whether you're vaccinated for MMR, and I have to provide that proof to my employer. And as part of another employer requirement, we do ask some of the workers in our health unit to have a TB skin test done to see whether they have been exposed to TB or not. So those are some of the things that the employers can set up those conditions, and any of the employer can have those conditions. So it's entirely up to them to set up those requirements. From a negative test perspective, I think if I'm understanding correctly, if someone was positive and then we are requiring a negative test. So if that was the question, we are not recommending that at this time, given that the individual can stay positive for a long period of time, up to 90 days or longer.
Okay, so if they tested positive but then test negative, it's not really that they can go back to work. They should still kind of stay off of work.
They have to stay off work for at least 14 days. But again, some of these are nuances that our team has to figure out, because there may be a reason that the initial test was positive because it was a false positive, and then the follow-up test results come back as negative. So those are details. I think I don't want to generalize it. I would say that those are the discussion based on the case investigation that our team do. And generally speaking, 90% of the time, if someone is positive, so the day they become positive or the days they start showing symptoms, 14 days after, they're considered no longer infectious. So they can go back to work and they will be cleared by public health to go back to work.
Okay, that's all for me. Thank you.
Queen's Park briefing?
No follow-ups for me. Thanks so much.
Okay, thank you everyone.